In New Zealand, cattle and deer are tested and monitored for TB as part of the TB-free program. Having a robust TB management program which detects disease provides confidence to international markets with regard to New Zealand cattle and deer products. There are two avenues where TB is detected: on-farm TB testing or routine slaughter surveillance at meat processors. TB testing is carried out by completing a skin test which uses the animal's immune response. If the animal has come into contact with bovine TB or similar bacteria, the test will be positive and further blood testing or slaughter will be required to help confirm the result. At slaughter, trained meat inspectors complete routine inspections of lymph nodes in the animal's carcass and internal organs, looking for TB-like lesions, which, if found, samples will be sent for further laboratory diagnosis. On-farm TB testing is completed throughout New Zealand. The frequency of testing is based on the TB risk to the herd. Cattle and deer in the areas like the southern North Island and the west coast of the South Island have a higher chance of contracting the disease from wildlife, as they are in vector risk areas, in contrast to regions that do not have known wildlife vectors such as Northland. Vectors are wild animals which can carry and spread this infectious disease. New Zealand's main TB vector is the brush-tailed possum. This means herds within the vector risk areas are TB tested more often. From a monitoring perspective, TB testing is completed annually through to once every 3 years, depending on the TB wildlife risk to the herd, using the primary screening test known as the skin test. Many herds that frequently send stock to slaughter or have a low TB risk to their herd may predominantly be monitored at slaughter, rather than needing a TB test on farm. Going forward, TB testing requirements will not just be based on local wildlife risk to the herd, but also on the herd's TB history, and if stock movements from at-risk areas into the herd have occurred. From a monitoring perspective, the frequency of TB testing is determined by three key components. Location of the herd. Is the herd located where there is a TB wildlife risk? TB history of the herd. Has TB been identified in the herd prior? And movements. The number of movements in and out of the herd or association to high-risk movements. Let's look at the process of testing cattle and deer. Tuberculin is injected into the skin under the tail, called the cordial fold on cattle, or into a shaved area of the neck in deer. 72 hours later, animals are checked for a visible or palpable lump or swelling at the inject site. If there is no animals found with swelling or lumps at the inject site within the herd, it is classed as a clear test and the herd is considered clear of TB. If the animal is found to have a lump or swelling in the inject site, an evaluation is done to consider if doing a blood test or slaughtering the animal to inspect for TB lesions is the next viable step to confirming the likelihood of the disease. If a blood test is done, a positive or negative result for TB is reported, and if negative, the animals and herd are considered clear of TB. If the blood results are positive, the animal is then required to be slaughtered and inspected for TB lesions. If lesions are found, laboratory tests are done to confirm it is TB. Post-mortem meat inspection is a key tool to identifying TB in cattle and deer through routine slaughter. When you look at the significance of slaughter surveillance, dairy herds are often culled at around 20% annually, which means dairy herds are potentially monitored for TB every 5 to 6 years, just through this form of surveillance. Beef and deer herds often send high numbers of fattening and aged stock to meat processors annually, which are monitored for TB. At slaughter, meat inspectors check lymph nodes, carcasses and offal for TB lesions. If suspect TB lesions are found, samples are taken and are sent to the laboratory for testing. Depending on where TB lesions are found at post-mortem, the carcass may be condemned or partly condemned. Even if the carcass is not fully condemned, the meat is not able to be exported. Alright guys, here's a couple of questions for you. Remember, if you can't recall the answer to the questions, replay this section. What are the two surveillance avenues that are used to detect TB in cattle and deer? What determines the frequency of TB testing on farm or if it's required at all? What do meat inspectors check for when trying to identify TB at meat processors?